Hi, I'm Dr. Bright. How are you doing today? Okay, let me look at your ears and see if we have anything that's usual. Okay. Tonsils look pretty well. Doesn't look like you have an ear infection. So what exactly is hurting you?
I've been having trouble swallowing. I've been real nauseous.
What else? Is that it?
I've been having muscle spasms in my leg, and I had a seizure the other day.
Okay. Let me go look at your charts and run some tests, and I'll be right back.
Okay, thank you.
Hi, Dr. Bright. Hi, Mr. Brown. We've looked at your blood test results and your MRI scans, and we've seen that you have adrenoleukodystrophy, and it's a genetic disease that's caused by mutations in the ABCD1 gene. It's a result of deficiency in ALDP, which is peroxisome protein, and the deficiency leads to accumulation of very long-chain fatty acids in plasma and tissue, primarily of the nervous system and adrenal glands.
I don't understand, Doc. Can you give me some history on it?
Okay, well, this disease started in the year of 1910. It first appeared because of Harborfield and Spearler presented the first clinical description of a patient with X-linked adrenoleukodystrophy. This disease was found in a 6-year-old boy. Then the disease was then repeatedly mentioned in the year of 1923 and 1963. Then in the year of 1970, it was given that name. It's mainly found in young boys. The symptoms that you've been having are very common. The symptoms consist of muscle spasms, seizures, trouble swallowing, loss of hearing, trouble with language comprehension, impaired vision, hyperactivity, paralysis, comas, and crossed eyes. And are those all the symptoms that you've been having, are the ones you've been telling me about?
Yes, especially the muscle spasms.
Okay. And we will try to give you a prescription for that. And you may ask, how is he diagnosed? It's diagnosed through a blood test, which we gave you. It's also diagnosed through genetic testing and newborn screening. When a physician like me suspects ALD, we will perform the two most common tests known as the MRI and the blood test. An MRI can determine where the damage is done on the brain tissues, and the blood test is to measure a concentration of very long fatty chain acids. These tests analyze the amount of very long fatty chain acids which are elevated in ALD. An MRI diagnoses cerebral ALD. Early diagnosis of ALD is very serious and critical due to the limited amount of time that the condition may be treated. Because once this disease has been progressed, there will be no way to reverse the neurological damage. And I know I'm not trying to scare you, I'm just informing you on the background of this disease.
I understand.
The treatment options we have for you consist of stem cell transplants and gene therapy. Stem cell transplants is a procedure done on the patient that requires the patient to receive blood stem cells from a matching donor. So you will have to find someone that has the same blood and matching blood as you, and they will transplant some of their stem cells over to you. The cell transplant purpose is to provide healthy stem cells that the patient is insufficient of. Before the stem cell transplant, you will have to get chemotherapy, and that's to, build your body up and get you ready for that blood transplant. The process involves chemotherapy to prepare your body for the donor cells as well. Meanwhile, the other treatment that's new to us is gene therapy. Gene therapy is a new treatment that has been discovered which requires the patient's blood stem cells to be removed and treated with the vector in a laboratory. The cells containing the vector carrying the new gene are then given back to the patient by basically like an infusion, so an IV. IV is put into your arm and the blood cells go back into you. Do you understand so far?
Yes, doctor.
The pathophysiology for ALD is caused by a mutation in the gene called ABCD1, which I've told you before. The genes provide the blueprint for creating proteins that play a critical role in the functioning of your body. When a mutation of a gene occurs, the protein product may be inefficient, absent, or overproduced. The prognosis for this disease usually isn't very good due to the fact that this disease did not have a cure, as well as it being very progressive in a neurological deterioration, unless bone marrow transplants is performed very early. It is common for the disease to lead to a long-term coma for about 2 years after the nervous system develops complications. A child with ALD normally can live with this condition for 1 to 10 years before the death occurs. So for the epidemiology, according to the U.S. National Library of Science, the prevalence of ALD is 1 in 20,000 to 50,000 individuals worldwide. In the U.S., 1 in every 21,000 men is thought to be affected by ALD, and that's not very much, it's not very wide. And while 1 in 16,800 women are thought to be ALD carriers. Yet per newborn screening conducted in the state of New York says the amount of babies born with ALD at birth was estimated to be 1 in every 15,000. 700,000 newborns screened for ALD and only 45 newborn babies were diagnosed. So ALD, yes, is a very serious condition and treatment must begin immediately. And I basically covered all you need to know, but do you have any questions?
No, Doc. I think you've covered it all for me.
Okay, so we will get you some medication and we will continue to run blood tests on you and we will try to start chemotherapy as soon as possible.